Good afternoon, all. It's a pleasure to welcome you to the Health and the Public Interest weekly seminar. Our special guest today is Alice Wolfson, who is a longtime women's health advocate, and she's got some wonderful graphics and visuals that she's going to share with you. So I think you're going to enjoy this one. The Health and the Public Interest program is a master's degree at Georgetown, which looks at the non-medical things that affect our health and healthcare systems, specifically social determinants, economic determinants, et cetera, that affect our health. Um, the seminar today is going to be moderated by June Padera, one of the HAPI students, and she's going to give an introduction of Alice momentarily. Basically, the seminar will last for around 40 minutes, followed by a question and answer discussion segment that'll be moderated by June 1st, inviting students to give their comments or ask their questions, and then going to the broader audience. So we're looking forward to having lots of participation today. And with that, I will turn it over to June.
Thank you so much, Dr. Myers. I'm so pleased and excited to introduce Alice Wolfson. She is a political activist and a pioneer in the women's health movement. After graduating from Barnard in 1961, she went on to obtain a master's degree from Stanford University and was then awarded a Fulbright scholarship to England. She is a co-founder of the National Women's Health Network and was the founder and executive director of the Committee to Defend Reproductive Rights. Ms. Wolfson was one of the leading voices protesting the lack of women's participation in the 1969 to 1970 Nelson pill hearings, as well as the deliberate withholding of information regarding the pill's dangerous side effects. The women's actions during the Nelson pill hearings and their subsequent demands for informed consent led to the first wide-scale patient package insert informing patients of potential dangers on a prescription medication. Ms. Wolfson is also notable for her efforts in the DC women's liberation movement. She was featured in the 2014 documentary film She's Beautiful When She's Angry, where she advocated for, quote, changing the whole paradigm, unquote, of underrepresented women's rights in society. A fun fact about Ms. Wolfson is that she and her ex-husband baked their wedding cake together and, as a result, ended up with a forgotten pot holder in their first bite. Thank you so much for joining us today, Ms. Wolfson.
Thank you for that. Well, let me quickly say that ex-husband is right. However, not because of the potholder. Okay. So, all right, let me start. Let me go way back to 1970, which I know for a lot of you is really back. I don't think that people have an understanding or a clear understanding of how little women were represented or mattered in the medical industry, in the medical profession, and in anything having to do with probably in society as a whole, but I particularly focused on health and the medical profession. I have one slide that I could show you that will kind of encapsulate the way women feel. Although I'm not going to be talking about tranquilizers at this point. You can see the prison that they thought that women were in, and the way to feel less anxious was pills, not changing society, not changing the feeling of being trapped in whatever women were doing. So let me go back to the beginning of my involvement in the women's movement. We can take the slide off. My first involvement was around the issue of abortion, and I think that most women's groups focused on abortion. Abortion was illegal, and I think that the analysis was pretty much, how can women really talk about freedom of any sort if they can't control their bodies? So I think that people really did start to organize around abortion and abortion rights. I remember one group called Concerned Clergy, which had an underground where we would funnel women who needed abortions into this place. And there were always a few doctors that people knew about who did it. And probably many of you have heard about the Jane Collective in Chicago. So abortion was an important issue. Back then, and again, I'm bringing you back to 1970, It was women could really not get any access to medical information. Men didn't do much better, but women in particular. Doctors were seen as white-coated gods that you never asked any questions about, and you absolutely could not get information about your medical history. For instance, now we have uh, pretty much access to our medical histories and what has happened. Our tests are on the internet. We can go in, and back then it was just about impossible to do. In terms of birth control, women who wanted a diaphragm, who wanted to be sexually active, had to go to doctors and lie about the fact that they were married. You had to be married to get a diaphragm fitted. There were many women who went in with rings, wedding rings on their fingers and fake names just to be able to get birth control. Hard to believe now, but true. Also in 1970, which was about the time that I was pregnant, there were about 7% of OBGYNs were women. Today, 87% of OBGYNs are women. So there has been change, and change that we've forced and made happen. I went to a doctor a few years ago, a woman, and as we were sitting after the exam, I said to her, "You're exactly who we were fighting for." It was somebody who was really present and just what we had hoped for. Not that women can't be bad at also, but generally speaking, I think it was a good thing that we did. Now women make up 51% of medical school classes. However, they only make up between 15 and 25% of chairs of medical departments. So there's really a long way still for people to go. Words such as breast and menopause, you just didn't say that. It was really, really hard to get information. I remember as somewhat before this, having an aunt who died, and my mother wouldn't tell me what she had died from because it was breast cancer. So that's another thing that women have done, is they've taken some words that were before just not verboten now and brought them out into the present. Support groups, which we see now all over the place, were very few and hard between. And women rarely showed up in medical research and in medical trials. They were kind of invisible in the healthcare system, except when the healthcare system wanted to use women in some ways. And this, I'm just naming a few. I'm sure that anybody who has any history in the women's health movement can name lots and lots of other ways in which women were discriminated against, but I'm trying to limit this. So let me go back to my beginning. In 1969, I moved from New York to Washington, D.C. At this time, the war in Vietnam was still happening, and my ex-husband had gotten into the public health service, which meant he didn't have to go to Vietnam. So we moved to Washington, where he had to be for the public health service. And at the time, I think his salary was about $12,000. And we thought we were rich. And we were so rich that I could spend all my time in the women's movement, which in DC was DC Women's Liberation. And I did. We had the group at DC Women's Liberation started to grow pretty large. We had a governing body, which we called Magic Quilt, because we didn't want to use names that men had used before. And I was in the Health Collective, which consisted of about 5 or 6 women, and we would meet regularly. Actually, we met almost every day. I've never understood how we managed to do this or where the money came from, but it did. And we were sitting around one day, the 6 of us. I even remember the person's house it was in, and we got to talking about the birth control pill. And it turned out that almost all of us had at one point or another taken the pill, and we had all suffered side effects, what we would call non-life-threatening side effects, but important to us. For instance, I started to lose my hair. When I went to a dermatologist, no idea why this was happening. Went to my OBGYN, no idea why this was happening. Turns out it's a common side effect of then the pill. Remember, then the pill had lots more estrogen than it does now, and there were many, many more side effects. Anyway, we heard that the Senator Gaylord Nelson was going to have hearings about the birth control pill in the Senate. And we lived in DC, so going to the Senate was easy. So we decided the next day, okay, we'll go and we'll listen. Getting in was simple. And I think now we can have that little video that shows what happened when we went to those hearings. Yeah. As you can see, we were all pretty angry. But let me just tell you a few things about the pill. The birth control pill, which now has so much less estrogen in it, and it's unbelievable how much it has gone down from like at the beginning, 10 milligrams, I believe. But I think it's important to realize that the pill was developed as a population control device. It was not developed so that women could have sexual freedom, although of course that was one of the effects, although there's a lot of question about that. In 1970, over 7.5 million women were taking the birth control pill. In fact, it was kind of handed out like candy. You want it, you can get it. And women couldn't wait to take it, clearly, because abortion wasn't legal. And the idea of sex without pregnancy was a great idea. You would think that a drug that had been so readily handed out to so many women would have good research studies, but this isn't true. The pill was tested in Puerto Rico. Why Puerto Rico? My feeling is because it was a non-white population, and it was largely an illiterate population, that these women, the original women, it was tested on 200 women, only 200 women. Remember, put that against the 7.5 million women who were taking the pill. Of these 200 women, 15 women dropped out. They were never followed. It was never determined why they had dropped out. And 3 women died, again, never having been followed. And then the pill was out there for women to take and for doctors to give as if everything was okay. At that time, Barbara Seaman, a journalist and a feminist, had written a book called The Doctor's Case Against the Pill. And we had all kind of read the doctor's case against the pill. So when we decided to go to hear the panel, we were kind of interested in what was going on. And at the time, getting into those hearings was really easy. You could never do that today. There were no metal detectors. There was nothing. You just got in and you just had to be there on time, which we were. And what we were not prepared to see was all men testifying. Of course, all the senators were men. There wasn't one woman, not even a woman who had taken the pill. No women researchers, no women doctors, which kind of went along with how many women were represented in general at that time in the medical profession. What we were prepared to hear was more about the side effects that we had had. And one doctor testifying said, in answer to whether or not he told women when he gave out the pill about the side effects, his answer was, yes, I tell her about the side effects, like weight gain, but I wouldn't go through the possible list of complications. I don't believe it's good medical practice. I wouldn't say now you may die of blood clotting or you may get hepatitis. So here's a doctor who feels safe to stand up in front of the Senate and say, no, he doesn't bother to tell women that there are some side effects that they might want to avoid. And at the time, it was I don't know how widely it was known, even in the medical profession, but it was known that in England there had been studies that showed that the pill was implicated in thromboembolic disorders, heart attacks, strokes in young women, hepatitis, other such complications, as the doctors would refer to them, which women were never told about. It was when we heard one of the doctors who testified that estrogen is to cancer, you saw that in the thing, what fertilizer is to wheat, that we really lost it. We had been unprepared to hear such a thing, and kind of surprised that they were saying it. We were never for taking the pill off the market, those of us who were demonstrating, and I'll get into the demonstrations in a second. We were, however, very much in favor of informed consent. We felt like women should be given the choice. They might still choose to take the pill, but they should know that there was a certain percentage of women who did suffer these thromboembolic disorders. Even today, whenever I hear about a young woman who suffered a stroke, my first question is, was she on birth control pills or some kind of estrogenic birth control? And invariably she was. So I think it's one of those dangers which we knew about. And I think that before a healthy woman takes a drug that affects almost every organ in her body, she should be given a choice, and she should be given the information to make an informed choice about whether she wants to do that or not. At the time, those of us who were active, we did ask, why isn't there a pill for men? And to this day, there still isn't. So let's see where we can fool around with women's bodies, not so much with men. The pill demonstrations, which were largely spontaneous. Certainly the first one or two were spontaneous. After that, we got smart and we started to put people at one end and in the middle and at the other end, and we kind of coordinated our questions. So these guards kept running in and trying to grab us out, and then somebody else would ask another question. And in the end, it was like we had every newspaper in Washington, D.C. taking pictures of us. I even got somebody sent me something from Der Spiegel. It kind of made national and international news that women were finally standing up for what was happening to their bodies. Because of our protests, one doctor suggested that a sticker be attached to the pill, and the sticker would read something like, "Do not take this pill without your doctor's continued supervision," something that hadn't been done before at all. Contact him. Notice we said him, not them or women or him or her or anything like that. No, notice the absence of women here. If you experience any unusual symptoms, this is what we wanted the sticker to say, such as severe headache, blurred vision, pain in the legs, pain in the chest or cough, irregular or missed period, not explained by the pill. This is where the fight really began. We faced so much opposition to a simple warning on the pill. We didn't understand it. And I remember speaking to Ben Gordon, who was then, I think, the head of staff for Gaylord Nelson. I said, I just don't understand it. Why is this going on? And he said, it's the population control movement. They don't want any warning on the pill. So understanding that didn't mean that we stopped protesting. And a lot of these protesters ended in a sit-in in the then Secretary of HEW's office, Finch. There were about 40 of us women, many of whom had nursing babies, others of whom had toddlers. And when they said, "Can you get the children out of here?" we said, "Oh, we'd be happy to. Show us to the daycare center," which of course didn't exist either. So it was, it did result in eventually a sticker. One of the employees at HEW walked in and saw all of us sitting there and said, "Oh, Lordy, the revolution has come to HEW." And we were successful in getting a warning on the pill. Now there's so much warning that nobody reads any of these out long explanations, or very few people read it, and it allows the drug companies to say, "We warned you." So it's just a way in which I think progress has been used in some ways against us. But if you think back to those days, there were no warnings on any medication whatsoever, and it was really up to the doctor. And what happened about getting that warning, when the fight was going on, Barbara Seaman had called me, and she was doing this. She was calling me and do this, do that. This is happening, that is happening, and we would just go out and do things. But she told us about this secret FDA meeting being held by the OBGYN panel, all men again, um, to discuss whether or not there should be a warning on the pill. Barbara told me to ask for one of the doctors there who was sympathetic to us. And when he came to the door, because we get knocked and knocked and knocked until somebody finally came to the door, we charged into the room. They tried to get us to leave. They told us that they were going to have us arrested. But I remember saying, "Okay, fine. We'll call the Washington Post. You can arrest women who are trying just to be safe." And I guess needless to say, they did not. And we were able to sit through the whole meeting. But during that meeting, I heard one doctor say something very close to this, might not be an exact quote, but it's like, "I don't want any warning on the pill. If you tell a woman she'll get a headache, she'll get a headache. And my wife will kill me if I get a call in the middle of the night about some woman on the birth control pill who has headaches." So uh, we faced a fair amount of opposition. And in the end, we did succeed in doing that. Out of the pill hearings, a number of us, me included, decided that we needed to have a more official voice in Washington, D.C. than just Barbara calling me and me putting something together at the drop of a hat. And from that, we formed the National Women's Health Network. At the time, there was some discussion about whether it should be the National Women's Health Lobby or network. We decided on network because it kept our nonprofit status in good shape, and we were still able to do some lobbying. And the organization lasted for 50 years. It grew, it became a national organization with people all over the country, and did some very, very, very important work. The networks had its first demonstration in front of the Food and Drug Administration. We had a funeral service for a woman who had died from a heart attack related to the birth control pill. We carried signs, as we were talking about signs earlier, reading such things as "Feed estrogen to the rats" at the FDA, and "Women's health, not drug company wealth." We were out there and we were demanding, in addition to a sticker on the birth control pill or a warning on the birth control pill, we also wanted women, a consumer, on the panels at the FDA, which did not have consumers at that time. Another group that I was a part of during this time was called WITCH, Women's International Terrorist Conspiracy from Hell. We would wear our witch costumes, which usually consisted of witch hats and capes, that we kept in our purses. We held such actions as putting a hex on the Capitol and hexing Garfinkel's department store's makeup department. And at the time, Garfinkel's was like Saks Fifth Avenue in Washington, D.C. It was like a really important department store. And we can show the pictures of us in the hex in the costumes now. This is us walking to the Capitol in our witch costumes. And we have another one, burning. This is us burning in effigy the Capitol building. And one more, there's also a picture of us at Garfinkel's. You can put the next one on. Okay. You might wonder why we picked Garfinkel's and the makeup department. It's because in those days, women's liberation days, women were taking the position that they didn't need to use makeup so that men would find us attractive. So we hexed the makeup department. But the action that I kind of remember the most was at a large international population control meeting. At that time, the population control establishment really consisted of the ruling class, like the Mellons and the Rockefellers. And this was a very large meeting. We planned this demonstration. A number of us came to the open meeting in a large auditorium, dressed in looking like normal people, which for us meant skirts. And and at a certain point, we took out our witches' costumes. We put on our witches' costumes. We ran up to the stage. We took the microphone away from whoever was speaking at the time, and we did a skit. And the part that I remember the most about that skit is we had a refrain. And the refrain went something like, "You think you can cure all the world's ills by taking poor women take these unhealthy pills." And then we would throw aspirin out into the audience. And needless to say, they disbanded that meeting somewhat quickly. Okay. Just for a minute, I want to just divert. I'm not going to talk about this, but for a second, let's talk about estrogen replacement therapy for women. Now there was lots of controversy about it, but at the time, the reason women were fed estrogen replacement therapy with or without symptoms was because it was a male idea that women could stay feminine, in quotes, forever if when they hit 40, they started taking estrogen replacement therapy. So just so that you keep that in mind. Another action that we did, also giving you some sense of what was happening in DC at the time, the mayor was holding a fancy meeting of doctors and public health people to discuss why Black children in the district, and at that point, the district was 72% Black, had such poor health. The meeting was supposed to be secret. We've somehow found out about it. We found out where it was. And we went to the meeting. We crashed the meeting. We swiped all of the fruit cocktail and all of the appetizers off the table. We substituted the appetizers for peanut butter and jelly sandwiches. And we took the microphone and then talked about why Black children might have poor health in Washington, D.C., which was notoriously poor health at the time. In fact, back to the women's health movement and the pill, a lot has happened that has come out of the women's health movement. There are things that organizations formed all around the country, and just to name a few, and again, I'll probably miss as many as I can say. Our Bodies Ourselves was then in its infancy. One of the books had come out. It was the first time really women were starting to really look at their own bodies. That was the time when a feminist named Carol Downer was going around to different feminist women's health centers or women's groups with a speculum, getting on a table, using the speculum and having women look at their vaginas and vulva and really say, these are our bodies. We can get used to it. You can get used to it. This is our bodies. As women began testing all of the orthodoxies and traditions around women, a lot of different things happened. We began to see changes, a lot of different organizations, and I'm just going to name a few that were formed at that time. Obviously, I've talked about the National Women's Health Network, Breast Cancer Action, the Black Women's Health Initiative, DES Action, the Coalition for the Medical Rights of Women, the Committee to Defend Reproductive Rights, feminist women's health centers sprang up all around the country. Although many of these organizations, for instance, Breast Cancer Action and the National Women's Health Network, have now closed their doors, their power and their ability to change the way women's bodies were looked at remains, and we can thank a lot of them for a lot of the answers that we now have, and some of us which we now take for granted, which we didn't have before. The women's health movement has been shaped by pioneers, by activists, and legal battles across the country. It has evolved from the grassroots kind of stuff that I was doing in the very beginning to be a multifaceted struggle. That includes abortion rights, medical equity, and gender-based violence. I think that we could all name lots of organizations. Obviously, I think the losses that we have suffered have been great, especially since the Dobbs decision. But some of our changes are things that we fought for, and I actually think one remain. And I'm going to just name a few. We now believe, I think it's generally believed, that women have the right to control their reproductive lives. We also have access to the patient package inserts and to, by and large, what the dangers of the birth control pills might be, or synthetic estrogen might be. We also have access to our medical records now. We go to the portal and we can basically see what our medical records are. Now, again, I think we should realize I'm talking from a person who has lived always in large cities. I don't know what women really have in rural areas, but in large cities, I think we can count on that. We also have instances of actual removal from the market of unsafe birth control products. For instance, the Dalkon Shield, high-dose estrogen pills. And just yesterday, I was solicited to join a class action against Depo-Provera, another injectable synthetic form of birth control, largely used in poor countries as a form of birth control. I never took Depo, so I don't know how they got my name, but there I was, and I think that was good. We also have seen an end to the Halsted radical mastectomy. It used to be that a woman felt a lump in her breast. She was told she needed surgery. She was never told going into surgery whether it was breast cancer or not breast cancer. She didn't know at all when she went in whether she was going to come out not just without a breast, but with a radical kind of surgery. So one of the first things that women who came out from the anesthesia would ask is, do I have my breast? And now that's simply not done. Because of largely a woman named Rose Kushner, who wrote a book called Why Me? And the women's health movement. Lumpectomy has become a favorite form of treatment, and when a mastectomy is performed, it's not performed in the same radical way that it was performed before. Fathers or birth companions in the birthing room, with the mother who was giving birth, never done before. When I had my first child in 1971, I was living in a commune, and when my water broke and I went into labor at GW Hospital, I brought about 6 people with me. And GW sort of didn't know what to do with us, so they pushed my bed out into the hallway so that everybody could be around. Then I got a real labor pain, and I said, uh-oh. And we got more serious. But in those days, there wasn't as much intervention as there is now in the birthing process. Alternative birth centers where you could go into something that looks almost like a home and you weren't in a sterile operating room. Those kinds of things did not happen before. Um, Consumer representation on FDA panels, like I said before, it used to be that the panels were secret. They were only open to professionals, which meant mostly men. They had not had any consumers. It's because of the women's health movement and the push of the women's health movement that there are now consumers on FDA panels. Previously, as I had said before, since there was a combination lock on the one that we burst into, these were secret. They are not secret anymore. Um, I could go sort of on and on. I think maybe it's time to open this up to questions. And I see Jan and Nancy, two old women's health feminists here. So anything you can add would be great.
Yeah, thank you so much, Ms. Wolfson. Like Dr. Myers mentioned before, we're first going to take questions from my classmates, and then we will take questions from the general audience. If none of my classmates have a question, I can start because I don't see any hands. But I was just wondering, kind of in this era where, and you touched on this a little bit, but in this era where the pill was seen as sort of like um, a potential force for liberation for women and having some more sexual freedom. Did you get any like backlash from other kind of coalitions within the feminist movement? And like, how do you think that that added like value or kind of power to your cause?
I don't recall getting much backlash. I think that the women that I had contact with wanted the information. And since we tried to make it clear that what we wanted was informed consent, we were not talking about taking the pill off the market. We were talking about people being able to decide for themselves. I there when you think about what we were talking about, that there should be a safe barrier method of contraception followed up by free and safe abortion as the safest form of birth control. Um, Remembering also that abortion was illegal. Some states it was a little bit more legal, but you still had to have doctor's notes and you had to have things that said you were going to go crazy if you had if you retained the pregnancy. Um, so I think that pretty much it was generally agreed that we should have the information. In fact, one of the things we did was we held a women's pill hearing. We sent out questionnaires all around the country, and we had our own speakers. And I think that they were pretty well attended. I have to say, I can't quite remember everything about it. I don't remember how long they were. I know that the findings were recorded in the Congressional Register. So if anybody can find it back from them, they probably have information there.
Thank you so much for that. We have a question in the chat from Dina Harris asking, in what way can women become more involved with the movement?
Well, um, okay, I'm going to go back to when I moved to San Francisco from Washington, D.C. It was a time when the first Hyde Amendment, which was the federal funding for abortion, was cut off. And I got a call from somebody I had known in DC that some women were planning a demonstration against the Hyde Amendment, which I can't remember now if it had been passed or was just about to be passed. And we had a pretty large demonstration, but myself and a couple of other women felt like the struggle did not end here. This was not going to be the last thing that we heard about abortion rights. And we formed something called the Committee to Defend Reproductive Rights. I got this organization funded. I eventually became the executive director of this organization, but we did two things of note. We produced something called the media book because at that time, the public radio and television had to have PSAs, public service announcements. A certain amount of time no longer exists. So we had a lot of public service announcements. We learned how to use the media, and we had a bus campaign. We got funding for a bus campaign, and we made posters that showed an older woman, probably not as old as me, but she had gray hair. A young woman, a woman with a baby, a Latina woman, and a Black woman. And the poster said, "Can you tell which one of us has had an abortion?" And underneath it said, "All of us." And so the organization grew to from about 10 people to about 500 people. So that's one way people can get involved. And we didn't have the Committee to Defend Reproductive Rights. We made it happen. And I think that women today, this is my opinion. You all have grown up knowing of legal abortion. You don't know what it was like when abortion was illegal. Um, I think that one of the things that has to happen more is more women have to speak out about getting involved. Really, high school women, any woman who starts to have a period should be really involved with both birth control and abortion rights. Um, so how they can do that, I what I think that funding is hard to come by now, but I think that we still have to try.
That's a wonderful answer. We have another question from the chat. Based on your experience, what kind of strategies should women's health advocates use today given the current political climate?
Well, that is a hard one, and I'll be the first to say that that's a hard one. But for one thing, you don't see any women's demonstrations. I would like to see that happen. I would like to see. We used to in San Francisco on the anniversary of the Supreme Court decision legalizing abortion. We used to have demonstrations, and always the anti-choice people would have a demonstration that would wind through the streets of San Francisco. So our goal was always to make our demonstrations larger, and largely we did. I think that we have to go into high schools. We have to form small groups because that's how we start. The groups have to become media conscious. They have to become public speaking places. And we should start to talk about what it means to be losing these rights. Believe me, I don't think it's going to stop at abortion. I think that the birth control pill is an abortifacient, essentially. The Dulcan shield, which prevents implantation from taking place. All of these things are really on the chopping block, I think, or will be.
Yeah. Thank you so much. So we have no more questions in the chat. I might be a little greedy and ask you a second question if I can. I just wanted to ask you, based on like all the methods you use, some of them were a little like unconventional and like I think had a certain degree of just like thinking outside the box. And I was wondering how much you think that like that degree of like fun a little bit played into your ability to like recruit people to the movement and also catch the attention of like the public and the media.
Well, it certainly caught the attention of the media. I used to, at one point, I called us Have Demonstration Will Travel. We were ready at the drop of a hat to just go out there. I think that part of it was that we weren't afraid. Maybe we should have been, but we weren't. We would go to all of these different things with $10 in our boots for bail money. But we were never arrested around these kinds of issues. Certainly we could have been, and that might have been sobering, but we weren't. I think that the kind of activism that we had attracted people. It probably turned some people off. I know that when AOC was beginning some of her activism, I thought back to the women's health movement and to the early things that we did. I wasn't surprised by any of it. And she's garnered a lot of attention. So I think that there are some ways that garnering attention is really important. I think that being outrageous but not wrong is important. And also, we felt very powerful. Um, we came from an underdog's place as women, that was happening, but we were angry. We felt our time had come, and we weren't going to take any stuff from men. Um, I think that maybe women are part of it comes from being so oppressed, which we were. I think that women's oppression is the oldest oppression that there is. Um, but we were not going to take it anymore. And feeling powerful, we did some things that were powerful, that did change things.
Thank you so much. Um, and then we have, I think, Martha Rosenberg would like to ask a question if you'd like to unmute yourself.
Thank you so much for everything you did. I believe that you and your other activists not only helped women's rights, but consumer rights, because
Yeah.
back then you also couldn't see ingredients on food that you ate. It was none of your business, none of that stuff. And so I really appreciate what you did. I can remember my grandmother got breast cancer. Nobody said breast and nobody said cancer. So you're absolutely right. Um, I remember Our Bodies, Ourselves was the Bible of feminist health information, and now it's hawking menopause treatments. And I personally believe Big Pharma has taken over a lot of women's health for the worse. So I'd like to ask you what you think about the revival of HRT and some of the other pharma initiatives that I think hurt women's health. Thank you.
Okay, thank you for that. And I think you're right. The consumer rights did grow as a part of everything that we did and other people did as well. I'm not aware of Our Bodies, Ourselves hawking ERT. So I want to say that to begin with. But I think that I'm not a scientist, so and I've never taken ERT. So but I've never taken it because I think it's dangerous. And I most of my friends have never taken it. Some of my friends, I have one friend in particular whose hot flashes were just awful and continued for years, and she took it for a little while. I don't know if the claims now about it being beneficial are valid or not. I don't have the science behind it. I do know that it was the National Women's Health Network that was one of the first voices that said there's a danger here.
I just
So
want to jump in here, Alice, because
yeah,
we're doing quite a lot on menopausal hormone therapy, and it's definitely being over promoted, again, not just by drug companies, but also by telehealth companies, compounding pharmacies, influencers who are selling all kinds of products. There's a lot of trashing of the Women's Health Initiative going on that is completely wrong, and farmed out's like sort of taken over the fight from National Women's Health Network on fighting over promotion of menopausal hormone therapy. But it's funny. It's like a lot of the claims that are being made from it today are like right out of 1960s
yeah.
feminist forever, like the little different wording. It's like brain fog, if you got brain fog, weight gain, depressed, unhappy with your relationships, whatever the problem is, menopausal hormone therapy will fix it. And of course, that's not true. And there are still risks.
For a while, weren't they even saying that it prevented dementia?
Yes, and it actually increases dementia.
Okay.
Yes. I'm linking to an article in the chat.
Okay.
All right, thank you so much. I'm gonna call on Lenore Latinx with her hand raised.
I think she's muted.
Okay, my doorbell just rang, so I'm going to stand by the door here. So we're of the same generation, Alice. I really appreciate this talk because we don't do enough history. But I had a thought of how to get things going. I wonder if we couldn't have a conference on the women's health movement, past, present, and future. I
Yeah.
went to a conference in 2014 in Boston, sponsored by BU, that was about second wave feminism, kind of past and present. And I know that a lot of things came out of that conference, small groups, publicity, people meeting each other. I mean, if there's one thing that the women's movement is known for, it's, groups,
Yeah.
collegiality and working together. And I just think that the meaning of the women's health movement is up for grabs in some ways. Some people would say, that it's female influencers is the women's health movement. Anybody who's self-defined as a woman and has something to say about health is part of the women's health movement. It's not seen as a political or ideological category the way you've presented it today, and the way those of us who remember back in the day it was. So I just, I'd like to reclaim that term. What do you think of that?
I think that is a great idea. Um, okay, this is perfect for all of you younger people. Organize, organize, organize. Make a meeting happen.
It takes a little bit more than that.
Well, not to start with, actually. Some of the biggest things have started with just a few people getting together and saying, we're going to work on this. And you need to have somebody start it, really.
Yeah.
Yeah.
Well, a lot of these, as Adrian posted, a lot of the organizations have tanked. Um, why do you think that is?
Funding, largely funding, and perhaps a little bit taking their eye off the ball, starting to become multi-issue. Um, like I know Breast Cancer Action did a lot about the environment, and certainly the environment is implicated in breast cancer, but I think it lost its focus when it started to take in more than it, more than the issue of breast cancer, really. And it used to be a place where you could go and get some honest other information. I'm sorry that it closed its doors, but I think it was largely a funding issue. Funding has dried up a lot for
I
the
think there's a lot of intergenerational um, conflict, is my observation, which makes it difficult to work together. And, people don't see different perspectives as coexisting. They don't have a sense of um, ambiguity is a welcome thing. It's
yeah,
like,
yeah.
so that I think that has also made it difficult for people to work together intergenerationally.
I also just want to point out that Janet Stallmeyer, Nancy Worcester, and Mary Omni Watley are on this call,
Right.
all of who have been very involved in women's health and the National Women's Health Network. And feel free to weigh in as well, you guys.
Really. Let me just say, hi, Jen. It's so nice to have you here. And Jen was a very, very good past chair of the National Women's Health Network. Oh, okay.
Yeah, that was such like an incredible little back and forth we had there too. I think that was really helpful for all of us to get some inspiration. I'm not seeing any more questions in the chat.
Adam had one.
Oh, sorry. Sorry, Dr. Mars.
No, that's
You
okay. I
had-
lowered my hand while the discussion was going on. Um, I just wanted to observe that in science and medicine in general, the big societies have kind of given way to smaller groups, right? That are just simply because science and medicine have proliferated so much, and we know so much more about some of these fields. So, looking at the women's health movement, of course, it's important to have a good core and to think about the future, but there's also things like the pregnancy justice movement, for example, and different groups like Birth and Color, which is looking at how women's health can be improved by the use of doulas, particularly in minority populations. So there's lots of other groups popping up that I think are pretty vibrant and doing some good work. And looking at the reproductive justice movement in particular, it's been driven a lot by um, legal people, lawyers who have been pursuing cases where, incarcerated women were really being robbed of all of their rights, not even to start to talk about the rights of the unborn in that case. So, and just as a segue to what I really want to say, Alice, which is with so many choices to make, where do you think some of our students should think of in terms of further experience or education they might get once they're done with our program to be effective in this overall area or some niche within it?
I'm really not sure where people with a degree that you're offering go. I have had a lot of people wanting to intern at different women's health organizations, but a lot of times they don't exist. I think that um, you're going to be more adept at thinking of what kind of organizations people can go in. But I think once people are there, um, that's when you find people maybe who think a little bit like you and you start to organize in that way, small ways. I think it is small ways, but I really do like the idea of a national conference of some sort. I think that would be great. I don't know how many people would attend, but I think that people are becoming more politicized. I think that Minneapolis is there for now for everybody to think about and to know about. So people are beginning to see some ways in which their organizing has begun to bear fruit.
So some of our students go to work for NGOs or government or other places, and some of them go on to medical school or law school or other future training. So actually, Alice, just on a personal level, I wanted to ask, so you went to law school as an older student, and what was that like? Like, why did you do that? And what's it like to change direction midlife like that? I think that might be useful for the students too.
Okay, well, I actually have had three careers. My first career was as an audiologist. Then when I moved to San Francisco to get licensed as an audiologist, I needed to take 10 more credits, and that felt like, okay, I wasn't going to do it. I didn't like it. And then I founded CDRR, got it funded, had a job for myself, and I think I worked at CDRR from 77 till 86. And the reason I went to law school is because I used to do tons of media work around abortion rights, reproductive rights. We took the position in the Committee to Defend Reproductive Rights that abortion was not a single issue, that women had to be able to have a choice to have or not to have a child, and the choice to have would entail access to daycare, food, etc. So we always saw it from that perspective, and I would go and I would have debates or just sometimes interviews, and people always thought I was a lawyer. So, so at a certain point, I felt like I needed to make more than $10,000 a year, which is what I was making as the executive director of the Committee to Defend Reproductive Rights. And I also needed to have flexibility because I had a son who had leukemia and I had to be around and be able to be to be there for his treatments. And it felt like being a student was the way to go. So I applied only to Hastings, which is in San Francisco, as the only school, and I did not take the LSAT. And I said, well, if I get in, I'll go. And then I got in, and so I went. And I have found of everything I've done in my life, being a lawyer was one of the hardest things in terms of the things that I had to know. I always thought that law school spends the first 6 months teaching you that there are no black and whites, that everything is gray, and then the rest of the time teaching you to prove what you're saying is black or white. So coming to it from an older perspective was helpful. I definitely, when I was looking for a job, experienced both sexism and ageism. There were several firms where I interviewed where they said to me, really, you should be interviewing for a paralegal job. And I had my law degree. I had passed the bar. So there was no reason for that. But I ended up in a small plaintiff's firm that eventually our whole practice was suing insurance companies who unreasonably denied disability claims. So I always kind of felt like I was a good guy lawyer.
All right, we have one more question from the chat, it looks like. It is, what are the frontiers for today and tomorrow, domestic violence or other? And also, could you share your thoughts on the use of social media as a tool?
The frontiers, I'm not sure what is meant by that, or what issues are the most prominent, maybe. For women in general, I think that they might be somewhat different. I think I think that on the president, that Trump has presented all sorts of issues to us. We're just about to hear that there may not be any midterms. So there are lots of issues that keep popping up. But I think we should all remember that when the Dobbs decision came out, making abortion illegal or sending it back to the states, which largely made it illegal in many states, which is another whole thing about states' rights, and that at first women were really, really angry, and it's kind of died out. I do think for women, reproductive rights, daycare, which is part, I think, of reproductive rights, are important and prominent issues, and that women should be organizing around those issues.
All
Okay.
right. I'm not seeing any, I said this before, but I'm not seeing any further questions. So I'm going to throw it back to Dr. Myers to play us out.
Okay, thank you, June, and thanks so much, Alice, for a stimulating talk and great discussion. In the HAPI program, what we try to do is really present lots of different topics and stimulate the students in particular in many different ways. And I think going back and giving some historical perspective and then discussing how it pertains to the future is a great, great exercise to have gone through today. So thank you so much. Thank you to the audience for being here today. And we look forward to seeing some of you here next week when Elise Trott Jaramillo from the University of New Mexico is going to be talking about indigenous and elderly populations in the Southwest and their health care disparity issues. So we'll see you again, and thank you to all of you.
Thank you.